Dr. Mitesh Patel, who simultaneously earned an MBA as well as an MD degree, is more attuned to the realities of the business world than most other young physicians. And as a medical student, he became concerned about the lack of health economics training in many of the country's medical schools. His latest journal article has sparked new rounds of discussion and debate about this issue.
Well, the response from around the country since the New England Journal of Medicine article has been remarkable. I've gotten emails, phone calls from students, residents, professors across the country saying, how can I help? What can I do? This is what I'm doing on my campus. This is what I'm doing in my community. Let me be a part of the new curriculum pushing this forward. We can't expect people to learn how to practice medicine on the go. That's just too hard. We need to start training physicians in the core principles of health policy when we start teaching them about the core principles of anatomy, physiology, and pharmacology. These topics don't just affect physicians' training, they affect patients' care, and they ultimately affect all of our lives. And it's something that has gone unnoticed over the past 15 to 20 years, despite data showing that there's a huge gap here. We know from our prior research that medical students are much less confident about their knowledge in the healthcare system than about their knowledge in clinical issues. We did a study several years ago and looked at more than 58,000 graduating medical students. And we found that among those students, less than 1/2 of them felt that they were appropriately trained in topics such as medical economics and healthcare systems. Most schools don't do a great job. We specifically looked at 2 medical schools, both ranked in the top 10, one with a higher intensity curriculum in healthcare systems, the other with a lower intensity curriculum. The one with the higher intensity curriculum had lectures with discussion sessions afterwards, and they had projects which spanned not only the preclinical years but also the clinical years. The other school had 3 lectures and 3 discussion sessions. And we found that students at the higher intensity curriculum were 3 to 4 times more likely to be satisfied with their training in the healthcare system than students from the other school. There are 3 main barriers to implementing this type of curriculum, both at the local level and at the national level. The first is that we need to move beyond the conventional wisdom that adding topics that pertain to health policy in the healthcare system is going to put strain on the current medical education system. And our prior research has shown that, in fact, quite the opposite is true. The second barrier that we need to overcome is that in order to teach this type of curriculum, you need faculty from multiple disciplines. You need health economists, you need people who are trained in business, psychology, organizational management, people that work in the healthcare system, people that work in the health insurance system. And so what we've suggested is that we overcome this barrier by creating national and regional curricula that might utilize online discussion networks or virtual lectures that could be tailored to the local needs. And then finally, the third barrier is that there's been very little research done in this topic. We don't know what the best way to implement a curriculum in health policy is. So we hope that medical schools and residency programs will participate in pilot programs and pilot projects to see what the best way is so that we can better train our future physicians. And we found